taking a step back, taking a moment to take a couple deep breaths, composing yourself and repeating to yourself, this is not and you can say the name of the patient or family member out loud, and continuing to remind yourself that this is an act of love.
Welcome to Baptist HealthTalk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hi, I'm your host, Sandra Peebles. Welcome back to a new episode of Baptist HealthTalk, where we answer your most searched questions on trending topics. Today, we're talking about the mental health challenges faced by caregivers, the importance of support and resources available on how we can break the stigma surrounding seeking help. We are joined today by Manuela Rodriguez, psychotherapist at Baptist Health. Thank you so much for being here.
Thank you for having me.
Let's talk a little bit about what are the different strategies or what are the different stigmas surrounding mental health and why do they exist?
First of all, I want to thank you for having and starting this conversation, especially for our community, our South Florida community, because mental health is not talked about enough. The stigmas are around, one, that reaching out for help is a sign of weakness. Two, we see that maybe some of us are not considering mental health to be a part of our overall well-being. Other areas of our well-being, such as our physical health, our spiritual well-being, intellectual well-being, and also asking for help could be seen as something that we don't externalize within our family. We might not seek help outside of close family members or to even talk about it in our community.
Interesting that you say within our family. Let's talk a little bit about those dynamics. What are some of the common dynamics? For instance, brother, sister taking care of one another, or parent, child. And how does that affect the caregiver? Because really, you have an additional layer. It's the personal relationship and then the responsibility.
Absolutely. And every family is unique. Every, group of individuals that are caring for either a patient or a family member is going to be interesting. And so it's going to be a matter of having that open and honest conversation amongst the village, all those individuals that are involved, that we are keeping everyone's mental health as a priority, not just the patient or the family member, but the individuals involved. So are we asking the caregiver how they're doing? What medical appointments they have? How are they caring for themselves? And if it's a sibling or a brother, the same, that we're opening dialogue for that conversation and emphasizing the importance that we all take care of each other so that we can continue to care for the loved one or the patient.
And I'm so glad that we're doing this and really focusing on that caregiver, which is often left to the side only because clearly we prioritize the patient and their well-being. But without a doubt, this is a difficult role to be in with a full-time caregiving and then maintaining your own life because you're taking care of this person's life, but you also have to handle your own life. So let's talk about why that mental health is so important for the caregiver. And again, so happy to be highlighting this truth for so many people.
Yeah, I think it's important to highlight that the mental health of the caregiver is just as important because they're going to be navigating the increase or decrease in symptoms for the family member. They're going to be seeing it day in and day out, the challenges. They're going to be navigating the appointments, the phone calls, all those tasks. Medicine, finances, the house in general, the chores around the house. There's so many things that are involved with not just simply caring for a loved one, but all the things that are involved. So when we keep the priority of the mental health of the caregiver, we give them an opportunity to see how much we value them and how needed they are in the community and in our families.
And it's so interesting as you're speaking, I'm realizing that really the caregiver is kind of running two lives, their life and the life of the patient. What are some of the stress signs? What are some of the signs that we should be on the lookout for?
Yeah. Some of the common ones are lack of nourishing themselves, right? Having proper fueling throughout the day.
You mean literally food?
Literally food. Fueling themselves. They know what to feed the patient or the family member, but they forget about themselves. So are they meal planning? Are they bringing their own food to be able to have the physical energy to lift, to move, right? If they don't have the physical energy, that's one sign that can be simply bringing a meal to help the caregiver at mealtime while you're visiting the patient or the family member, right? To make sure that they're fueling themselves as well. They often avoid their own doctor's appointments because the priority is for the patient to see the doctors, get the follow-up, get the medications, and not giving themselves enough time to recover when they themselves are sick. Being exposed to the sicknesses of their patient or family member is going to lower their immune system. So it's really important that if they're not getting proper recovery time or the proper treatment, it's going to be difficult for them to come back into their role fully motivated and fully with energy to keep doing what they're doing. And they're so needed.
And as I'm hearing you speak, really, there's also the factor of that this person, if the patient is a terminal patient or if it's a progressive disease, that we're speaking about the caregiver really grieving the eventual
absolutely
passing of their loved one, and that's something that they might not show signs. So it's something that maybe we can recognize beforehand.
Yeah, we can recognize, we can talk to them, ask them questions on how they're doing, how they're navigating the changes in the symptoms, how they're navigating the updates in medication, how they feel towards the patient, because they do form an incredibly strong bond and relationship. And if it's a family member, it's okay to go into some of the stages of grief where there's denial, right? There's loss of what that life could have been or what it was going to look like. And that's okay to have those doubts, to have those worries, because we are human.
On the flip side of all this conversation is those who do have access. So how have you seen, what has the positive impact been for people that you see that actually do have access and do reach out and get help?
If you're reaching out to get mental health help, whether it's an individual or a support group or a group therapy, all of those modalities and styles will increase the likelihood of strong communication. They will build trust in the individual that's taking care of you, and trust for the person that's receiving the care, right? Receiving the care and giving the care. There has to be a strong trust relationship that this is something that, yes, I want to do, or maybe sometimes it's unexpected. The role has been given to you unexpectedly due to a traumatic accident or something that was not expected. So when you take on that role as a caregiver unexpectedly, it takes a different aspect. But when it's something expected, even if it's expected and has been talked about, there's different dynamics that have to be discussed.
And what are some of the most common mental health challenges that these caregivers face when they have a patient or a loved one who has a chronic illness or any other disease that maybe is impeding their independence?
Absolutely. And that word independence is important because the person being cared for might see themselves losing that independence because now somebody has to care for me. And that caregiver feels the pressure to, not pressure, but maybe how can I continue to show them that they can do things, that we can go out, but it is a task. Sometimes feeling that burden that I'm the one responsible for carrying the wheelchair, carrying the water, carrying the walker, all the supplies that may require for simply going on a walk. And so caregivers may feel isolated, alone. They'll, distract themselves from saying, why don't we do something else? And that limits the interactions with other people, right? Other people that are also caregivers. And so I go back to recommending a support group or a group therapy where you do not feel alone. We are not alone. The more and more we talk about this topic in our community, the more I hear from colleagues, physicians, professionals that we are on similar boats.
Well, that's
not the same boat.
It's precisely, well, yeah, but it's a very similar boat. I was precisely going to ask you what advice would you have for someone who is in this situation, who is caring for a loved one at this moment? What can they do to better manage their well-being while they're being a caregiver?
Yeah, it's giving yourself grace as much as you can, giving yourself that time to say the behaviors, the symptoms, the progression is the condition and not the individual, which is hard, right? Because sometimes we associate it with this individual getting aggressive with me, may it be female or male that you're caring for. Aggression can be scary, right? It can be a moment of saying, all the work that I'm doing, all the love that I'm pouring in, and this is their response. But it's also a challenge to say, this is not this individual or this patient that I'm caring for, or my dad or my mom. This is the condition, which can be really hard to say. And I get goosebumps saying it because it's easier said than done.
Clearly difficult to separate when you're living in that moment. How can family members best care for the caregiver, if you will? How could they best support their mental health, their well-being in general? What can family members do?
So family members, we have to get creative and intentional. Sometimes even going over for a visit and saying, I'm coming over to visit dad, and dad is the one that's receiving the care, but bringing some lunch for mom, or simply doing the dishes while mom is sitting for some short amount of time, right? So that she can get some rest. So it's being creative and intentional. Sometimes asking, what would you like to do when I'm over at the house so that you can get some rest? But even that can trigger some moments of, I got this. I don't need rest, right? So it's just showing up and saying, I got this.
Because the caregiver is in survival mode sometimes as well.
Absolutely.
I can do it. I can do it. I can be responsible. I can give you that love that I promised you my entire life, perhaps, if it's a family member. What are some strategies that caregivers can address to, well, precisely to deal with what we kind of touched on? Don't take it personally. If it's a person that has Alzheimer's, for example, the patient could potentially be aggressive. What strategies can we implement to say, okay, this isn't against me. I understand that this is the person that's sick, and maintain that peace and maintain that patience.
Yes,
Such a difficult word.
Yes, such a difficult word. And I think it's taking a step back, and it can be literally taking a step back, taking a moment to take a couple deep breaths, composing yourself and repeating to yourself, this is not and you can say the name of the patient or family member out loud, and continuing to remind yourself that this is an act of love. The love that you're giving to this person is, you can't compare it to anybody else, right? So you are offering them care and love. And at that moment, those behaviors can be stronger than what's expected, but reminding yourself and giving yourself that grace to say, let me take a couple seconds. I'm going to take a couple deep breaths. Remind me that this is not my dad or my mom or the person I'm caring for. It's the condition.
This is a very, very important conversation that we're having, really. And the more that we speak, the more that I like it. There's no doubt that there's an interesting dynamic when it comes to siblings sharing this responsibility. What can you tell me about that, and how best to divide the workload? To be honest, because I don't want to say it that way.
It's divide and conquer, right? We definitely, there's so many things that are involved in taking care of someone that the tasks need to be spread out evenly amongst family members, if that's an option, or friends, whether it's the community, resources, family members, who is going to be part of that village, and really seeing what are the strengths and weaknesses that each family member has, and being honest with each other. And I'll share personally that I care for my aging parents and alongside my older sister. And my strengths are time management, scheduling, calling and booking appointments. And her strengths are those extracurricular activities, those movements. She's well into movement and loves taking my dad out to track meets for my nephew and go get ice cream. But it is a lot for my mom to go out and get the ice cream or go to the track meet, because there's a lot of moving parts. So what we encourage her is that support. This is what Valeria, as my sister, is going to offer to help in those moments, to continue to bring that movement so that she doesn't feel isolated and that she's alone, that we can do this together. And then I help with the time management, the appointments, the reminders on a weekly basis. And it also impacts the proximity of the family members and also financial situations. It's important to consider, right? So speaking openly about what some of those limitations can be, right? Family members that we have that want to help, but that live in another country is difficult. But there are ways. We connect them monthly on a Zoom family call, and they ask the questions. How's he doing?
Fabulous.
Because it's hard to ask those questions or answer the phone calls during the day for my mom. And family members want to know, and they want to see how the family's doing. But if you can't answer the calls, they're like, wait, what happened? They're not talking. We don't know anything about your dad. And so we build those techniques into what works for our family.
Sometimes people might not even think about that they can do that or realize. Speaking about this access or reaching out for help, do you find that men and women approach this mental health issue differently? And if so, how?
And everyone is unique, right? Men and women are unique in how they experience mental health. But studies have shown that men respond to mental health and therapy. We see behaviors such as aggression. They may become more irritable, or they might isolate themselves. So we see shutting down, and we'll see those behaviors, right? And we'll want to address it as a family member with them. And they won't see that taking care of their mental health is just as important as their physical health, their financial well-being, their spiritual well-being. So there's other ways to kind of show that mental health is a part of our overall well-being. And in women studies have shown that it's more socially acceptable to talk about our feelings. So we'll talk about it with our friends. We'll talk about it with other family members. So we will take the action to reach out for therapy. But it's still important that we see mental health as part of our overall well-being.
So how do we encourage men to reach out for that help?
We tell them that it's also part of their physical health, their financial well-being, their spiritual well-being, and it's going to really impact how they interact with their colleagues, decisions that we make, how we connect with colleagues, or even if we're leaders or mentors or we're menteed by someone, how we interact with each other is going to be crucial for success in any relationship.
So from a mental health standpoint specifically, what advice would you have for someone who knows this is coming down the line, who has a parent who's maybe aging or perhaps has been diagnosed with something that hasn't progressed yet? What would you tell that person?
First and foremost is taking care of yourself. We have to start taking care of ourselves now, building these mental health toolkits, which we like to call, right? Because as we approach that condition, the disorder, or things that are unexpected in life, we're going to have that toolkit ready. It's just like having the first aid kit, right? We're going to use the tools in it, but we're not going to use all of it all the time. And every so often, we're going to have to revamp that toolkit. We're going to make sure that these tools are working. And that's the importance of why we incorporate therapy, because with a therapist, you will have the opportunity to fine tune some of those techniques that have worked in the past and maybe are not working the same, and trying new things that are going to help you navigate the challenges that you're living.
Yeah, there's really nothing like the support of having a therapist that can really lead the way when they know where you're going, when you don't know where you're going and you feel confused. So if someone has questions or want further resources, what does Baptist Health offer?
Yes, we have our community health classes that alongside my team at Community Health, we offer virtual and in-person classes on topics such as nutrition, doc talks, mental health talks, because this conversation doesn't just end today, right? We are going to encourage you to continue having these conversations about mental health, especially when it comes to being a caregiver. So you can attend those community health classes. We have 988, which is a hotline, which is the suicide and crisis hotline that can be a resource to the community. We have our online screening tool, which is not a tool to diagnose, but it is a tool to screen an individual that may have difficulty answering some questions in person. So you can answer them on your own time in your own space. And it populates resources that are available to you. And also NAMI, which is the National Alliance on Mental Illness, offers free support groups for individuals with a mental health disorder. And they also offer support groups for caregivers with a mental health disorder. As we've seen the increase in the importance of this conversation, now there are support groups for the caregivers as well.
That is fantastic. Thank you so much. This has been so enriching and fulfilling, really. I think it's incredibly important that people realize that it's okay to not feel okay sometimes. It's normal, and it's a lot of pressure. Taking care of a loved one when we see them in decay, it's very, very difficult. So this is such an important conversation. Thank you for being part of it. Thank you for sharing your insight with our audience. And remember, viewers, to be sure to hit that subscribe button on our channel right here to keep up with the latest health and wellness information and tips from our experts like Manuela. Thank you so much for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.